Oral sex. To some of you, the term can be very exciting. To some of you, the term can be very disgusting. But common to both, you all want to know more about it. Today, I, Dr. Sudeshna Ray, would talk about oral sex and its consequences. It is a taboo subject, but couples do want to indulge in it at times as a part of their sexual pleasure. It's not uncommon. It's just another form of sexual pleasure or sexual activity. If you both consent for it, it is considered to be natural and fun. Both man and woman can take and give oral sex. It's commonly known as going down or a blowjob or 69 or giving head. It has official and medicinal names too, such as cunnilingus, fellatio, anilingus, etc. The benefits. Like any other form of pleasurable sexual activity, it has advantages of giving you a good sleep, keeping you young, controlling your BP and keeping your heart healthy, and relieving you from the pains and aches of the body. However, many experts say that oral sex is not a form of safe sex. Now, oral sex without protection can be safer than genital sex without protection in terms of preventing a pregnancy, because pregnancy can't happen with oral sex. However, oral sex without protection does carry a risk of sexually transmitted infection. This is because you do come in contact with sexual fluids such as vaginal fluid or seminal fluid. Now, the risk is more if you give rather than receive oral sex, because you're more exposed to the sexual fluids. 2, if you have ulcers or cuts in the mouth while having oral sex. 3, if you're not using protection. Now, sexually transmitted infection through oral sex can be HIV, herpes, syphilis, gonorrhea, viral hepatitis, and HPV. HPV or human papilloma virus infection through the mouth can also be a reason for throat cancer. Teens and adolescents often feel that oral sex is safer than genital sex because it will prevent a pregnancy. However, they should also be aware that it is a way of sexually transmitted infection too. Now, oral sex can be avoided in certain situations. 1, if you or your partner have any kind of ulcers in the genitals or in the mouth. 2, if any of you has recent genital or mouth piercings. 3, if you are unsure of your partner's sexual history. 4, if your partner has a known STI. 5, if the woman is in her periods. 6, if you have a throat infection. Again, the best way to prevent an STI through oral sex is by using a barrier method, either a condom on the man or a dam on a woman. Also remember, an STI can be completely treated if detected early. So if you have any symptoms or you're anxious about it or you're unsure about it, please contact your doctor ASAP. Do write to me at drsudeshnacares@gmail.com or watch my Insta live.